Matthews, and you're listening to Houston Weekend Magazine. Joining me today is Dr. Raghu Athre, a board-certified head and neck surgeon and also a facial plastic surgeon here in the Houston area down in Clear Lake. And we're here today to talk about rhinoplasty and plastic surgery in general. So why noses?
I love noses. I
Okay.
don't know
That really
why,
sounds funny, but go ahead.
I love noses. I mean, noses is my thing. I mean, I think everybody has the one thing that they really identify with. First of all, you can see me here. I got a decent-sized schnoz, number one. But number two, rhinoplasty is one of the most technically demanding surgeries. It requires a lot of preparation, a lot of attention to detail, taking into account a gazillion factors. The patient's height, the patient's body type, the patient's facial structure, their ethnicity, their skin type. I mean, that's just a few of these little things. And you got to put all of that together to get something that fits on them that looks like it's such a part of them that nobody's ever touched it. And that's the hard part.
When we're talking about noses, it's such a touchy thing because you either have those patients who want to tell everyone, I've got a nose job, or you have those people who won't tell a soul. And so is that something that you also notice a lot with your patients?
It's 50-50. There are going to be the people that come in and just say, hey, I've been thinking about this forever. I'm ready to do it. I've told every single person on earth. And then we have patients that come in and say, you know what, I've been thinking about it, I want to do it, but I haven't told a soul. So how many days do I need to barricade myself so that when I go out, not a single person knows that I had anything done? So they come from both walks of life.
Is that the surgery right now, quote, the in surgery is the nose job, or are you seeing other stuff as well?
We do a lot of other things as well. We specialize in facial plastic surgery. So we basically do eyes, faces, noses, hair transplantation. So that's kind of what we do. Rhinoplasty is kind of, there's no in time and out time. It's kind of the numbers stay pretty stable over time.
Okay, so what about at the moment? Like, what is the trend that you're seeing right now as far as the people coming to your practice?
At this point in time, it would be rhinoplasty in this little segment of time right now. The reason why is we're coming in on Christmas break, so a lot of rhinoplasty patients are younger patients. They've got time off from school, college, high school, that kind of time, so they want to fit their surgery in during the holidays or coming up for spring break. So that's why it's kind of the hot point of surgery right now.
Okay, and that's what I was going to ask. What about the age of patients that you treat?
I treat patients all the way from about age 14 up.
14, though? That's young for a nose job.
It is. And it really depends on, there's a couple of different factors. So first thing is, I really got to evaluate the patient. Number one, with respect to their facial growth, facial skeleton, that kind of stuff, some of the anatomic stuff. The other thing is also psychological maturity. Psychological maturity is a huge portion in determining whether that patient's ready. Some of the younger patients, though, like for example, I will take a younger patient if, hypothetically, baseball to the face. That kind of thing. So you do get a couple of those sports injuries, got hit in the face, need to get my nose fixed, had a hump to start off with, let's get it fixed at one shot.
Okay, but the cosmetic reason, you're not going to have a typical 14, 15-year-old coming in to just get it fixed for fun?
Not really, no. Your average age group for that cosmetic nose is probably going to be women age 17 to about 25. And then there's probably a second little hump in there, probably in their late 30s, early 40s.
Okay. What other facial plastic surgery type things do you do for your patients that you see a lot of?
Okay. So we do a lot of mini facelifts. That's a very common procedure that we do. And that's probably a pretty high volume procedure that we do because of the age population in Houston. A lot of younger patients. And the people are demanding more low downtime procedures where they can get a little bit rejuvenated and head back to work quickly. Eyelids, we do a lot of eyelid surgery.
Is that like lifting the eyelids to make them not as droopy or not as saggy?
Correct. Okay. So it can range anywhere from lifting the eyelids, and then we do a couple of lower eyelid procedures which are very interesting to kind of remove some of the bags, some of the puffiness, some of the loose skin, redrape that to get a little bit more youthful, rejuvenated appearance.
Okay, what about the dark circles?
Dark circles are a very tough thing, and it can be caused by two main categories of things. First thing, some people, actually what they have is a little bit of fat that's kind of pooching out, or they have a groove right underneath their eye. And in those people, what can happen is the way that the light chronically hits it, it causes more of a shadow effect where that's causing the dark circle. That's pretty easily rectified with surgery. The other type of dark circle is a little bit more difficult to fix with surgery. This can be due to basically hereditary changes where people have, certain ethnicities have darkening of that lower eyelid skin, as well as some people who have kind of excess blood vessels in that area. There's a couple of things that we can do for that and it's more of a cosmetic masquerade type thing in order to kind of fix it over time, but not an instantaneous fix-up.
Right, and if it's hereditary, it's not something that you can walk in and walk out with.
Correct.
With these, okay. Now, going back to nose jobs, since that's something that you're seeing a lot of, and that would make sense during the holidays, people using that downtime to get it fixed.
Yeah.
So they could show up at their Christmas or New Year's Eve party with their new,
right,
overall look, really, because it changes you.
It changes their face dramatically.
I mean, in that regard, you can't give the same nose to every single patient, right?
No. There are some people who kind of have their stereotype nose. I really believe in the nose has to match the person. We do a lot of ethnic rhinoplasty, so we take care of a lot of Persian patients, Lebanese patients, African American patients. So you can't really have one nose that fits on every single person. That cute little 5'3" blonde cheerleader nose doesn't fit on a 5'11" guy. So you've got to kind of see the overall patient and take into account some of those factors I discussed earlier with respect to, height, shape, facial geometry, those kinds of things, to find a nose that works for them. Part of it is kind of finding out what the patient wants. A lot of these patients come in with pictures and they go, hey, this is something that I saw in a magazine. I think this is going to look good on me. And then a lot of them also have, what their siblings look like, what their moms look like, and they want to have something that's kind of more like one of their siblings. So you kind of have to put all those pieces of the puzzle together.
Can someone really bring in a picture of, say, a celebrity or just anyone and say, I want this nose? Because I would think that it would be difficult. You can't just take someone's nose and put it on someone else's face and it look normal. You
hit the nail on the head. You can't, if someone walks in and says, here's a picture of Angelina Jolie and I want her nose. It doesn't quite work that way. What we kind of do is say, okay, so what do you like about Angelina's nose? Is it you like the way it scoops? Do you like the definition at the tip? Okay, so we find out the characteristics that they like about that and then try to modify that to fit that patient's face. And sometimes, I'll be honest, I'll just say, hey, listen, you know what? You may love this nose, but I really don't think that this is going to work with your face, and you're going to look either A, too done, too plastic, or you're just not going to be happy with your appearance afterwards.
I mean, it blows me away that people do this. I mean, of course, I'm okay with my nose. Now, I mean, funny story, my dad's nose is huge, and it's always been very large, and people would tell him as I was growing up, you better watch her, because if her nose gets to be as big as your nose, you're going to have to pay for her nose job.
Right.
And it's always, I'm okay with my nose, but it's definitely something I'm conscious about. However, it's never occurred to me to literally go under the knife, because I know that it's a lot of recuperation, and it's not an easy in and out type of surgery. So it blows me away that people are willing to do this.
You'd be surprised. It's actually not a bad surgery overall. You really look far worse than you feel.
Okay.
I will tell you, the vast majority of my patients will tell me that surgery doesn't hurt at all. Sounds absolutely crazy.
Yeah, I'm giving you a crazy look right now.
Okay, yes. But what they tell me it feels like, and I've had some nasal surgery done myself, what it feels like is you feel like you have a really bad cold. You can't breathe through your nose, your face feels heavy, your face feels swollen, feels like it weighs 50 pounds, and you're breathing through your mouth, you've got cotton mouth, you've got kind of a sore throat. That's what you feel like. It doesn't hurt unless you try to grab your nose and move it around or something like that.
Or get hit in the face.
Exactly.
Yes.
But unless you do something like that, it doesn't really hurt. Downtime for something like this, a lot of my patients really are back to work within a couple of days. Now, when I say that, I got to kind of put a few disclaimers in there. What I mean by that is this. The thing that limits them to being able to get back to work and doing regular life activity is, to a certain extent, vanity. So if they're okay with everybody around them dealing with the fact that they've got a little splint on their nose and they got a few bruises on their face, they'll feel up and at them to do what they really want to do. But if they want nobody on the planet to know that they've had anything done, their downtime's probably in the ballpark of about 7 to 10 days.
Okay, so still we're not talking weeks here.
No, not at all.
Okay. And I've seen people with a little splint on their nose before, and it's like, really, what is that doing? So, I mean, what is the purpose of that?
So this is kind of a little bit of the voodoo that different surgeons do. I'll tell you what I do, and I can't answer for every other surgeon out there. So what I do is I do put some bandages on top of the nose, and the primary reason for those bandages is to basically kind of hold the swelling at bay. It's applying a little bit of pressure. What the splint does on top of that is basically providing kind of a protective layer. It's a custom molded splint that we use that's kind of custom to your specific nose. And what it's really doing is kind of protecting it. So because, I mean, people don't know what they're doing when they're rolling over in bed or going to sleep or whatever. So this kind of just keeps that second layer of protection while everything is healing.
Okay, and that makes sense. It's more of when you're not paying attention and when you could be outside and, you know, something flies at you.
Right, right.
And that would be scary. So now, going back to the pain part of the actual surgery, I guess what I'm thinking of is when you've seen it on like TLC or the shows where they're taking the hammer and they're like hammering in and breaking their nose and like fixing it. I mean, that's all part of the surgery, right?
That's all part of the surgery.
That's what scares me.
It sounds crazy. First of all, not everybody those things are called osteotomies. That's what that's called when you're breaking the bones or moving the bones around. Not everybody needs osteotomies. You need osteotomies if the bones are crooked or if you're taking a big hump down or something to that effect. It sounds absolutely insane. The nurses who work with me in the operating room say exactly the same thing. I can't believe you're doing this. But after they've been with me a few times and they see the patients afterwards and things like that, they will say, I can't believe it, but they really didn't feel anything. I mean, these patients, we just did a nose job a few days ago. The girl was in the recovery room after surgery, and she was sitting there, is it over yet? Is it over yet? I mean, she had no idea that the surgery, anything had happened. So it really is, when patients are comfortable and they're anesthetized well, they really feel nothing.
Okay. And, of course, do you see your fair share of patients who just have issues as far as a deviated septum or the sports injuries? I mean, do you treat those people as well?
Of course. I think the big part in doing nasal surgery, I mean, cosmetic portion is a very important part of surgery, but the functional portion is also very, very important. So this is one of the things that my big things that I really believe in is doing a full analysis of the nose. Because you can have the greatest looking nose on the planet. If you can't breathe, it's worthless.
If it doesn't work, what's it doing on your face?
Exactly. So you kind of have to take the full thing into account, figure out what you're doing, and have one definitive surgery that addresses everything you want. Both the functional as well as the cosmetic things in one package. Because you don't want to keep going back in there time and time again to do multiple revisions.
Okay, and I've heard about like having people that have their sinuses cleaned out and that sort of thing. Is that something that you guys do as well?
We can offer that. We do. I'll tell you the majority of the time, I'd say probably over 95% of the time, when somebody comes in and we do a full analysis, we say, okay, the septum's deviated, blah, 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 and we fix it. So we fix the functional issue. We can pretty much prevent sinus issues. I will tell you that over 95% of my patients will say that their sinus problems are pretty much done after you set that septum straight. They're breathing better, things are kind of moving better. They're pretty much solved.
Yeah, I mean, the flow of how it's supposed to work is all been taken care of. And what about snoring?
Snoring's an interesting issue. Snoring has multiple different factors that can cause snoring. It's not all nose, but in healthy patients, blah, 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 in that subset, if they have a really crooked septum or their nose is really crooked or they've got valve collapse, a couple of different things, if they can't breathe through their nose, there's a good probability that that's causing them to snore at night and have an incomplete night's sleep. Once you fix their nose issue, a large percentage of those patients, they breathe better, they become back to nasal breathing, and their snoring gets better. I'll tell you my personal experience. I told you earlier I had some nasal surgery. I was not breathing through my nose because of several sports injuries, and I got my septum fixed, and it really changed my life. I mean, changed my life from being able to actually breathe through my nose. I stopped snoring. I used to snore. Don't snore anymore. And just in terms of exercise endurance, being able to run without kind of getting winded easily. So there's a lot. I mean, it did change my life.